The FDA is expected to approve the Moderna and Johnson & Johnson booster vaccines as soon as today. The Moderna booster could be available to anyone 65 and up and individuals at higher risk. J&J will open its booster to everyone over the age of 18. Also up for approval, mixing and matching those shots. And now the White House is rolling out a plan to get young kids vaccinated quickly. The FDA is considering approving the Pfizer vaccine for children ages 5 to 11. The plan comes on the heels of new CDC data showing Pfizer is 93% effective at keeping adolescents ages 12 to 18 out of the hospital. The White House says there's enough vaccine to give to all 28 million kids in the 5 to 11 age range in the U.S. They plan to administer the vaccine in smaller doses and use smaller needles. Meanwhile, New York City is the latest municipality to mandate vaccines for city workers or they will lose pay. CBS News' Natalie Brand has more on the mandate pushback and the White House vaccine plans.
The White House rolled out its plan to vaccinate children ages 5 to 11 as soon as it's authorized, which could happen in early November.
These vaccine doses will be shipped with all the supplies needed to vaccinate kids, including smaller needles.
The plan is to give the vaccines in kid-friendly spaces, including more than 25,000 pediatric and primary care provider sites, as well as hospitals, pharmacies, and schools. And the administration is planning an educational campaign to ease any concerns parents may have.
We will work with schools to send letters home to parents. We will convene doctors and health clinics and support them in delivering vaccinations as soon as they have conversations with families.
For adults, the FDA could authorize the mix and match of different COVID vaccines as booster shots as soon as today. The White House COVID response team says more than 2 out of 3 eligible Americans are now fully vaccinated, but there are still holdouts, and some of the unvaccinated are willing to lose their jobs. New York Mayor Bill de Blasio announced all city workers have until the end of the month to get vaccinated or they'll go on unpaid leave.
I'm saying this to every mayor, every governor, every CEO. It's time for these mandates. Finish this war, or we're going to have COVID with us way too long.
Vaccine mandates are impacting first responders in several cities. Los Angeles Fire reports that there have been about 241 separations from the department. Baltimore's police department is down 279 officers. And in Seattle, a group of firefighters marched up the steps of City Hall to turn in their boots rather than comply with the Washington state vaccine mandate. Natalie Brand, CBS News, the White House.
For more on this, I want to bring in Dr. Taison Bell, a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Dr. Bell, welcome. So the New York City mandate now says get vaccinated or go on unpaid leave. Before, city workers had the option to undergo weekly testing. So do you think that weekly testing could still be good enough to keep COVID cases in check?
I think that before Delta variant really changed the game, I think that would have been a reasonable policy. But what we've seen from the Delta variant is that it does build up levels in the nose and mouth quicker than the usual sort of what we call the incubation period. So, testing, that is, regular testing is a good strategy, but it's just really not good enough when it comes to what can you do to most ideally protect yourself. Now, New York City has around 71% of their employees already vaccinated, so we're trying to get the last bit. This includes firefighters and police officers who, just like healthcare workers, the nature of the work requires that you be in close contact with others, some who are immunocompromised or high risk. And let's not forget, this is good for the actual workers who are getting vaccinated. 5 times more police officers have died from COVID than from gun violence on the job. So if we're thinking about the best ways to protect the public and the workers, getting vaccinated really is the key moving forward.
And speaking of getting vaccinated, President Biden is now releasing his plan to get kids ages 5 to 11 vaccinated. For adults who've had the vaccine, it might be an easy decision to get their kids inoculated. But for those adults who are vaccine hesitant themselves, it might be a tougher decision. What sorts of encouragement and education do you think the Biden administration needs to get out there to make sure that all parents are comfortable getting their kids protected against this virus?
Yeah, that's a good question, because even among parents who are fully vaccinated, I still get a lot of questions about children. So the important thing to get out there is that while it is reassuring that children do not tend to have severe disease from COVID-19, and that's certainly still the case with Delta, because it's more transmissible, more children are getting infected and more are getting sick as a result. And now we can point to the fact that severe disease is relatively uncommon in children, but there's still more effects from COVID before we get to those severe outcomes. So for instance, 10% of children develop long COVID. My hospital recently admitted a child who recovered from COVID, but then developed long-term symptoms and couldn't climb the steps from a shortness of breath. These are the kind of things that we want to prevent. There's also data recently showing that children have high levels of virus in their nose and mouth, and so they are potentially at risk of transmission to others more so than before. So when we look at the combined benefits of getting vaccinated versus the risk of being unvaccinated, I still think the evidence really strongly supports getting children vaccinated, and that's why my own children will be first in line when they're eligible.
And so the FDA is also expected to approve mix and match booster shots, Doctor. This option is certainly good news for a lot of reasons, but do you think that between mix and match and having different boosters approved for different ages and groups of people, there could be some confusion as Americans try to figure out what option is best for them? And would you recommend people who do have the option, let's say you're in a large metropolitan area where it's easy to get your hands on various vaccines, would you recommend just go ahead and do the same one if you have access to it?
That's exactly why this is so important. So I think if you speak with public health officials, state and local health departments who are trying to coordinate vaccination efforts, one thing that they really wanted is the flexibility to mix and match vaccines so that, for instance, if someone who received Pfizer as a primary comes in for a booster and there's no Pfizer available but Moderna, that is someone who you don't turn away. And we know enough about the vaccines now that we can reasonably say that having mix and match strategy could have some benefits, and at least there shouldn't be a preference, is what the science has shown. So I think it's really smart policy. It makes sense at this point, and it increases flexibility. I think the messaging to combat the confusion really is that the vaccines are still very safe and very effective, and get the one that you're eligible to receive. And, the risk of turning someone away goes significantly down if we decrease those barriers and allow that flexibility.
All right, Dr. Taison Bell, thank you so much for sharing your expertise with us.
Thank you.